This is a Walker Street Doctors Update for Thursday, the 7th of April 2022. The purpose of this recorded update is to address questions that we get asked repeatedly during the previous week or fortnight. So, our funded flu vaccinations have arrived yesterday. They're funded for everyone over the age of 65 and under the age of 5 and anyone else with a chronic or medical condition. You can call our practice to book in with our practice nurse at any time during the week for your vaccine. We are additionally running a vaccine clinic on Tuesday and Wednesday afternoons from 1 to 5 p.m. and we've allocated extra staff members to those afternoons to run those clinics. I've had a number of people tell me that they wouldn't normally get a flu vaccine and ask if they should. Well, the aim of any vaccination is to reduce the severity of the disease. And if we're lucky, also to reduce transmission of the disease in the community. Are flu vaccines safe? Yes. Are they effective? Yes. Are they free? Yes. If you fall into one of the categories listed above, and $30 otherwise. Are they available? Yes. So none of us have seen the flu for at least 2 years, but now respiratory viruses are circulating again, and the planes will bring flu back into the country. Yes, I would advocate getting the flu vaccine this year. Additionally, I'm a little bit confused as to why a third of the population over the age of 16 would have their first 2 COVID vaccines and not bring themselves up to date with a third vaccine. The purpose of the third vaccine is to return circulating neutralising antibodies to COVID up to reasonable levels 3 months after the second dose. There's obviously a lot more to the immune response than antibodies, but they are the first line of defence and the best chance to reduce the severity of disease. So why would you have a third dose if you've already had COVID? And the answer is to keep up circulating antibodies to protect you. This week alone, I've seen a child who has his second episode of COVID 9 weeks after the first episode, and a young woman who has her second episode 10 weeks after her first episode. An episode of COVID is supposed to protect you for at least 12 weeks, but my experience this week tells me otherwise, in some patients. This also calls into question the other phrase that I hear quite a lot when I ask about isolation procedures in the home when one family member's infected. Well, I might as well get it now. I'm going to get it at some stage. Well, getting it once won't stop you from getting it again down the track. We've already started giving the winter booster to many of our patients aged over 65 when it's 4 months after their third dose. This winter booster can be given at the same time as flu vaccination in different arms. And again, just give us a call at the practice to book in for both of those together. I'm also hearing the phrase repeatedly, now that the pandemic is over. To borrow a phrase that Raina McIntyre uses, that really is hopium. With more than 22,000 cases registered in New South Wales and 16 deaths due to COVID in the past 24 hours alone, the pandemic is obviously far from over. I get that everyone's thoroughly tired of it, none more than us. But I would respectfully ask that when you do come into our practice for vaccination or for any other reason, that you do wear a well-fitting N95 mask at all times in order to protect our workforce and to protect our most vulnerable patients who might be sitting beside you. And just a reminder, if you do have to take a phone call in our surgery, sound actually does transmit through a mask, and there's no need to remove the mask for that purpose. And I hope that update's been helpful.